Welcome to Maheepathi Talks. As you're aware that because of this COVID-19, it's a great time and the virtual platform has become one of the best platforms for interacting and sharing knowledge. We are glad and happy that our today's resource person has accepted to deliver the talk on stress management, which is very, very important for any person because now we are undergoing a lot of stress. There are many people who have been talking about the stress and how to make these things happen, how to control the stress, how to manage the stress. There are many kind of stress-induced diseases that have been cropping up, and the first time I could say that India is facing, of course, globally it's a pandemic as we are aware. The topic for today's session is stress management during this COVID-19 era. I'm glad to introduce Dr. Radha who has been working as an associate professor at ICBM School of Business Excellence. And she has done a research on organizational behavior from the University of Hyderabad and received her PhD. And she published many quality papers and debuted publications in two Scopus indexed journals. And she also has got 12 years of experience, more than a decade of experience with teaching and training. And she also had got 5 years of experience in full-time research. And she's also a research person for national level workshops and MPBs, the topics of academic research and HR analytics. She also has done a lot of certification courses and received a lot of certifications from reputed institutes around the world through online mode, like the Indian Institute of Management Coaching Code and from Indian School of Business, ISB. I hope that all the people who are from management background know the importance of these courses and this how they are glad and happy that my ma'am has accepted to deliver the talk on stress management during COVID-19. Now I invite Dr. Kiranmayi to deliver the talk on stress management.
Thank you so much, sir. I'm really pleased and honored to have my introduction done by you. I would just continue with the session with your permission.
Please go ahead.
Yeah. Hello, dear friends who are online. I really welcome you all today for this session on stress management during COVID times. And as Sir rightly said, this is the current thing that we all are concerned about today, especially with students who of all ages, right from a little child to a student pursuing his PG or a higher education. Stress is something that is really affecting today. And so I thought, I would select this topic for my further presentation and tell you some tips of how to handle stress, right? So, and I also want you people to understand the different types of stress so that, if you really need some help, you could just go out and, ask for help, because it is very important that in certain situations to ask for help when stress really increases. And as Sir said, the stress related diseases occur to human beings, right? Which generally are neglected by us. So this is, about my topic. So let's start today's presentation. Okay. So these are some of the things we are going to see, and I'm going to adjust today. I'm not going to waste much time here, but I'm directly going to dive into the topic. So let's try to first understand what is stress, right? And what are the different types of stress, and why is stress a must to be controlled? All of us know what is stress, right? And Benjamin Franklin said that stress is often termed as 12th century syndrome, born out of man's race towards modern progress and its ensuring complexities. So stress is basically something that a man is undergoing, and something that a man has created for himself. So stress is not something that is an internal disease, but it's a lifestyle problem that a man has created for himself, and that he is facing the complications with the same. So there are different types of stress, as I told you. We are just going to see. So let's try to understand what is stress in more clear ways and what is stress management. So generally, stress is a feeling. Okay. And different people react to stress in different ways. Some have aggressive weight loss, some indulge in eating, some different people, some want to smoke, some drink, different. There are different ways in which people handle stress, and most of the ways may not be right, and people do not know the right way to handle it. And that's the biggest problem of India, because psychological problems are not addressed to be diseases or problems in India. So, and that's one of our biggest uh, drawback that we are facing right now. So what are the signs of stress? Okay, when I ask people, in my class, in the earlier sessions that I've conducted online or offline, when I ask them, are you feeling stressed sitting at home? Or I just ask them, how are you feeling sitting at home? I get answers like bored and frustrated. And some even want to say, they want to hop and jump on the roads and go somewhere on a long drive or so. So no one is pretty much happy sitting at home, right? So there are different ways that we address stress. When we say stress, there are different ways that we as human beings try to understand it through certain symptoms. And what are those symptoms? Generally are, these symptoms could be divided into four basic classifications. The first one being physical symptoms, second one is mental symptoms, third one is behavioral, and fourth one is, when you are especially working, it could be job related symptoms, right? Other problem symptoms are you don't get sleep, yeah, and you don't get it for no reason, no matter how hard you try. Okay, that's called insomnia. Loss of mental concentration, where you're not able to focus on a particular thing because your body is not ready to do that, and you really are very preoccupied in something else, or you feel very tired, right? The third one is absenteeism. You are absent, you're bodily present at a particular place, but you are not really present in that place at that particular moment, and that is an indication that you're having stress. The fourth one is depression, that I would be coming on after other topics which I don't want to touch, and which is a problem that I want to address to some of you who might be, stressed for a very long time and should realize the importance of finding out if you're really depressed. And here the term depression I'm using is not the term that we generally use when we are disappointed or sad. This term depression is a serious issue that needs medical consideration, right? Extreme anger and frustration is one of the signs of stress, especially in the age of adolescence, where people fight. You fight with your parents, you have a fight with your friends for no reason, and you just react, and then later you might regret about it, but you can't help yourself doing that, and you feel really bad of doing that after you do that. But when you do it, you really don't understand you're really doing it. There could be some family conflicts, and very common indicators are migraine, headache, or backache problems, or something like that. Now, coming back to depression concept, in this slide I just wanted to introduce this topic a little to all my little dear friends sitting over there, that depression is not, but most of the times when we say we are depressed, we are actually not depressed. But if you are depressed, you should know when you are depressed. Depression is a mental state that comes out of stress. Initially, when you have a lot of stress, your body will be willing to take that stress for some extent. But later, when you engage your body in, mentally or physically into too much, your body will not really take it. And at that particular time, definitely one of the point would be you would be either very sad, or you would be very angry. But when that prolongs, and you get all other symptoms like insomnia, absenteeism, and migraine, regular headaches or backache problem, or loss of weight, or weight gain, sudden weight gain, right? Then slowly your brain, there is a gland over, on the bottom of your brain, that produces hormones into our body, that tells our body to function, right? And in that state, if your body is really very stressed up, that gland that is under your brain starts producing wrong hormones. That is, if you get hurt, instead of sending signals to your skin to heal, it would send signals to some other part of your body to do something else that is absolutely unnecessary to your body. So your body starts getting really weak, and you're not responsible for it, your condition is responsible for it, and that is the exact state where you call it to be a depression. And symptoms of it are excessive crying, body pains, right? And getting hurt unnecessarily because you're not there, you're absent, instant weight loss within a week. All these are signs of depression. So if anyone is undergoing such things, be very careful. I think you should go to a counselor, talk to someone, and take help. It is completely treatable, but it has to be diagnosed, right? And please do not use the words depression just like that anywhere, because really, if you're sad, that's okay, your body will be able to heal, and nothing is wrong with your brain, because that's only a feeling. And so that's not depression, this is depression. So you should it just creates depression, and so you should limit the stress that you would give to your body and mind. What are the causes of stress? So far, we have spoken so much about stress, and I directly jumped into what is stress and what is depression. Now I just want to come out and try to discuss what are the causes of stress. The very first cause of stress are insecurities. Most of the times when we are scared, we are uncertain with what is going to happen in our future, that is where our stress starts. So if you're not sure about something, your stress levels would peak up. High demand performance, especially for students and employees who do not who who feel that they are expected to perform higher, right? Personal and family problems, and sometimes technology was also found as a reason of stress in certain words. So, lack of knowledge to utilize technology, or you know too much technology, too much of screen time, all these also causes stress. So speaking about stress, and speaking about the negative effects of stress, now I come to a slide where I want to explain you if stress is all very bad to our body, and if it is very bad to our body, then why does our body allow us to take a certain amount of stress, right? Stress is not completely bad thing. Stress is something that is good till some extent and bad after that. So there is a very narrow line that separates good stress and bad stress, right? The stress that is good is generally called as eustress, and the stress that is bad is called as distress. And there is a very narrow line between eustress and distress, and that is why we do not know when the stress turns negative on us, right? So what is eustress? Eustress is the positive stress that we all should have. Eustress is something that makes us competitive. Eustress is something that makes us more prepared. Eustress is something that make us feel satisfied after we finish that work, because after so much stress, there are certain hormones released in our body that relax, and we really feel satisfied. Eustress is something that gives us energy. Eustress is something that makes us feel excited. So eustress is something that is really very important. If we don't have eustress, we become lazy, we become we do not run for any targets, and we do not have any goals in our life. So eustress is something that is really very good. It is a motivator that motivates you. It brings out all the positive energy in you. So eustress is something that is really good. So the results of eustress are increased concentration, because still your stress are at manageable level. You can concentrate properly because there's a lot of positive energy in your body. Your performance is increased because you set certain goals and you want to achieve those targets, and that is how your stress helps you in achieving. And it energizes you in motion, because it motivates you to go further and not to compromise at a very lower state, but it allows you to move forward and take that extra step that that can lead you to success. So eustress is the positive stress, that is something very, very good. But the problem is we cannot stop at eustress, and we seriously do not know where this eustress stops. So that is the real problem of the world today. So what do? We drag ourselves into distress. And distress is the exact contrast of eustress. Distress is something that causes us anxiety. Distress is something that puts our body mentally and physically into a lot of pressure and tension. Distress is unpleasant to feel. Distress affects our performance because we can't really focus, we can't really concentrate, and distress is something that eats us away, mentally and physically, takes all our energies, and it's negative to our body. So distress is the unpleasant stress, and eustress is the pleasant stress. So what are the negative impacts of distress? Loss of motivation. Eustress gives you motivation. Distress is bad for motivation. It really makes you demotivated, and it really makes you start feeling very tired, and you don't go up to it. Distress reduces your effectiveness because you're too high to perform something, or too emotionally you're not stable to perform something. And distress also creates some problems in your physical and mental activities, and it can even lead to behavioral problems. So distress is something that is bad. And now we are going to talk, in the coming stress slides. Whenever I mean stress, I mean distress and not eustress. Eustress is something good, so you should have it, you should try to develop it through certain mechanisms that I'm going to tell you in the later slides. Right. So this is the stress performance connection, where you can see how we are. If you are having really low stress, you are lazy, you're not alert, and only when you have certain stress, slowly you are, when the stress levels reach optimal level, you really perform. But when this keeps on increasing, it leads to anxiety and disorganization. So this is the level where we always want to stick to. We do not want anyone with very low stress, we do not want anyone with very high stress, but we need the optimal level. And seriously, the problem is we do not know what is the optimal level. But we our body knows about it. We just whenever we feel we are falling towards the zone, we need to control it, and I'm going to give you certain tips of how to control it. So let's now try to understand, as I promised you, I'm going to give you certain tips to control your stress. I'm going to show you some things. And apart from that, I'm going to give you an activity or exercise that would reduce the stress, both emotionally and physically, to all of you. And that would relax your body and calm your mind. So how do we do that? How do we distress ourselves? How do we, burst our distress? Be prepared for changes. Okay. So whenever you're planning is something that is very, very important. When you start up activity, no matter how small it is, and you plan for the negatives and positives in the same way. So you expect what could be the possible negative outcomes that you might encounter, and be prepared for it. If you're writing an exam, the worst possible scenario could be that you fail the exam, and you should try to minimize the problems that you will encounter. Right. And that is through proper planning. So you have to be prepared for the changes. Then you have to find and protect time time to refresh, re-energize, and remotivate yourself. Just excuse me. Yep. Right. So you should find enough time to prepare yourself to do a particular thing. You should realize that you have enough energy, capability, and capacity to do a particular thing, right? And always have healthy habits, waking up early, having a little exercise, going early to bed. maintaining your meal times are always optimal for all health conditions, including stress. And avoiding certain habits that you're not supposed to have is also a very good thing that you should do for managing your stress. Then positive attitude is a really useful thing. Most of the times we as human beings are problem facing, so whenever there is a problem we worry about problem. Now we have COVID, we worry about COVID. Now we are bombarded with worry newses, we are bombarded with worry messages, we are bombarded with everything that we could worry. But the best thing to do is to stop worrying about it in only one way. When you have to stop something, you have to start something else. And what do you do if you want to stop worrying? The next thing you do is start finding a solution. So do not always, when you shift your focus from a stressor which causes you stress to a solution, generally your stress levels are reduced. So stop thinking about stress, but start thinking about the solution, and that is how in real life you can reduce the stress, right? And then there could be some breathing exercises, meditation and exercises that could be helping you to really de-stress your body, which we will be speaking about in the coming slides, right? So now we are friends, we are going to speak something about stress management, right? So what is stress management is, we all know there are two types of stress: distress and eustress. Eustress is something that is very, very important to us, so we are not going to manage that. We are actually trying to improve that, and we want to reduce the negative stress, that is the distress. And reducing and keeping the negative stress in limited range, and seeing that we have enough of eustress is called as stress management. But generally, when we read about stress management, we generally think that it is completely reducing stress. No, it's not completely reducing stress, it's actually increasing your eustress and reducing your distress and bringing your stress levels right to the correct point or optimal point where you can perform. That is called as stress management, and that is something that has a lot of benefits. If you can really do it in your real time, it is really beneficial. So this is about stress in general, and this is a need of the hour, because in COVID times, especially for the students who are sitting at home and who are listening to the online classes, and the life has become a little uncertain right now at the present moment. Everything is not going in the way that is planned, and something really very big and very unexpected has turned up on our way. So, dear friends, now I'm going to give you certain tips and activities that we would be doing at the end of this video, right? Which would allow you to reduce the stress mentally and physically. So, remember that you should think about the solution rather than the problem, and you should follow a healthy lifestyle. Plus, the tips that I give you would really help you in managing your stress and keeping your eustress really high and an optimal level. So before we go further, I want a little more. Just wanted to give you a little more information on stress management. There are two types of stress management. There is acute stress management and chronic stress management. Acute stress management is for a short time. You suddenly got a problem that you have not expected, and you immediately have to react to it for a very short time, and once that is done, the problem is gone, you are out of it. Then that is called as acute stress management, right? Acute stress is really for a short time. And how do you know that you're going through acute stress? You would be having a lot of tension. There could be symptoms like headache, backache, stomach problems, stomach ache, or rapid heartbeat, or muscle aches or body aches. So these are some of the symptoms that show you that you're in acute stress. But the moment you are out of the problem, generally the stress disappears on its own. So this is not something that again we really have to deal with. Though it is distress, it is for a shorter time, our body can manage it and we would not end up into anxiety and depression. So we need not, really have to worry about the stress. But the second type of stress that we are going to discuss is chronic stress. Chronic stress is something that is very, very prolonged, right? It could be because of a very big disaster that happened in your life. And some of you might be undergoing chronic stress during COVID time. For some of you it may not be, but for some of you it could be a chronic stress. A lot of uncertainty has been happening since last 1 year, and you know some of you would be having certain disturbed goals. And today, I would like to concentrate on those audience especially, because they have been suffering for a very long time, and there needs to be certain exercises that would relax them up, or that would show them that they need medical attention, right? So the chronic stress is a type of stress that exists for weeks, that exists for months, or that could even exist for years, right? Chronic stress could be some basic things that because of which chronic stress could be are poverty, broken or stressed families and marriages, chronic illnesses, and successive failures in life. So people suffering with chronic stress, do not even realize they are suffering with stress. Their lives, really get. Some of them are who have very, long history of chronic stress, get used to chronic stress, and they don't even know that they are in stress anymore. And without knowing, they land up in very harmful state of health, because they start getting different problems. And these are the people who really need a lot of attention, and need to handle their stress at this particular time. So how do you do that? No matter what stress you are in chronic stress or acute stress, the first thing that you do is have certain exercises. Point number one is that you maintain a healthy lifestyle. Point number two is you stay away from all the habits that could hinder your process of stress healing. And point number three is you have certain exercises. And I'm going to tell you certain stress specific exercises now. So the first one is shallow breathing. This is for all kinds of stress, especially the acute stress, right? Shallow breathing allows you to, reduce your stress. Shallow breathing is taking deep breaths and releasing your stress out every time you exhale. Then you can always try the Superman position. Superhero position is a position that has worked for so many people very well. And this is again for acute stress, where you have a stress for very short time. Like for example, you're going for an interview, or you are about to get into your examination hall, or your paper is really tough, or it could be something that is there for a very short time and you want to handle it. And if you're really stressed, your legs are shivering, you are sweating, then what you do is you have the superhero position. You really have to stretch your body, put your hands on your hips, and stand straight, look into the sky, and deep breathe for 30 seconds. My dear friends, I'm telling you, this is one of the very proven habit that has really worked for millions and millions of people who know it, because this superhero position gives you a lot of confidence to tackle acute stress. This might look silly, but yeah, this has been proven by many people, and this really works for many people. And this is not something that I'm saying. All the things that I'm bringing out on stress, I have come from excessive research done by many researchers around the world. Third one is visualize and communicate your vision. So this is again a very good habit for an acute stress situation where the stress is really for a very short time. So what generally, the tip here is you bring in the scenario in front of your eyes, you enact that scenario, and you try to see what happens in different situations. Just sit down, relax, take some shallow breaths, and try to visualize and communicate on what would be happening later. This really is again a very very helpful technique where we could our stress levels could reduce, because for a very short time you're taking some stress and you are quickly trying to reach to the um, solution for it. And so this method again will really help you in the long run. Next one is laugh and crack some jokes, right? This in a stressful situation might look very silly, but laughing really helps in very stressful situations, because it releases certain hormones, and that that helps us in releasing the stress out of our body. So these are some of the things that research tells you to do. Crack some jokes, do some goofiest impressions, or tickle a child you love. These things really make you laugh, make you happy, and those hormones will immediately release your stress. Beware of your choices, and you always have a choice. So just don't think that you do not have choices. There are always options available. Every problem has a solution. So you should know what are your choices. Again, you sit down and you jot down your choices, and the best way is taking a pen and paper and trying to write down what are the possible options, or what is the worst thing that could happen and the best thing that could happen. Just jot it down, and that would release your stress in many ways. But all these steps are for acute stress. I'm still not speaking about the chronic stress, because for that we would be doing the activity in the end. The last thing that you could do for acute stress is start learning saying no, right? See, you saying no is something that is very very difficult, but we think it is easy, but this is something very difficult when it comes to the real hierarchy in the organizations, right? So saying no does not mean disrespecting someone or being arrogant. Saying no here means when you are not able to tolerate something, and when something is going above your heads, and it is really causing you a lot of stress, and that you cannot tackle it, then you ask for help and say that you cannot do it. Admit that you cannot do certain things, and that's okay, because all of us are human beings. And that is how you can tackle acute stress. But again, as I'm putting it in one of my last slides, this is one of the last option. You can as far as you can do it, you can say yes for it, but the moment you feel it is out of your boundaries, you can simply say no. And you really have to learn this art. Last thing is be thankful. Be thankful for all the opportunities that you have got in your life. Be thankful for everything that every person that helped you in your life. And just by being thankful, most of the times, your stress really decreases. So, dear friends, these are some of the things that you could do for the chronic stress, acute stress things, where you just sometimes you could only relax, listen to music, all these so I'm not just going through those slides again, but these are some of the things that you could do for releasing your acute stress, that is the stress for very less time. Then you have a strategy in stress management called ABC strategy: awareness, balance, and control. So always when you know why and what is causing you stress, and when you can balance it, neither too high nor too low, and you can control it, your stress is managed. And it's very easy to say, but sometimes difficult to do, but these tips can help you. These are certain stress reduction methods that we have already discussed. Now we have completed the different methods for acute chronic stress. Now, my dear friends, I would like to concentrate on people who have built acute stress over time. No matter you believe you have stress or not, you could simply follow my instructions for now and try to release the stress in your body. And I'm telling you, if you do what I say for next 2 minutes in the most sincere way, you would definitely feel some stress released out of your body. And continuing this activity with a little bit of meditation and other things would really try to release your stress to a lot more extent. But if you believe that your anxiety, your anger, or you know if you believe that you're depressed, then I would suggest you go consult a psychologist immediately. This is nothing bad, but you seriously need a medical attention, right? For the people who are just in stress and not bigger words like anxiety, depression, or anger, people who really angry and need anger management, right? So for them, my procedure would work if you do it on regular instances wherever you really feel your stress, right? So this is for a very lower levels of stress, and you cannot use this is not hardbound principle to be used for a very high levels of stress. So now I just want to give you some instructions which I want you people to follow through during my video, through which you can understand how to release stress out of your body. This method was developed by one of the world renowned universities, and this method has been coached by one of the professors of those universities, right? So I just ask you people, because all of us are in COVID times, and especially for the students who are really very stressed and who do not know what is their future and it's uncertain. Remember, there are always options, and it's time you release stress out of you. So please sit comfortably on a chair wherever possible, in whichever room you are. And for next 2 or 3 minutes, please close your eyes and listen to my instructions that would help you come out of a lot of stress. Please sit comfortably, close your eyes, and now I want all of you to feel their toes. Toes are the fingers that are present on your legs. So toes, right? Feel the tips of your toes. And I want you people to fold your fingers to an extent where it starts paining and a little hurting yourself, right? Please close your toes and pull them uh, near your feet so that it starts hurting a little. Take a deep breath, keep your toes closed, and please release the pain out of your toes and relax. Now please do the same thing with your lower part of your legs under your knees. Make the muscles under your knees really tight in the sitting position. Twist your legs. Put pressure on your knees. And let the muscles really flex. Release the pressure. Take the deep breath and release. Continue doing it to the upper part of your leg. Stretch your legs. Stretch your legs really very tight. Close your toes towards the feet. Put the pressure on your legs and release. Release. Now put a lot of pressure on your stomach. Stretch the muscles of your stomach, pull them in, take a deep breath and pull them in. Stretch them. Put a lot of pressure on your stomach and release. Now exhale completely. Take a deep breath and exhale. put a lot of pressure on your chest. Feel the pressure in your chest and release. Now I want you people to take your hands, put them far away from your body. Just open your hands, wide open your hands. Close your fingers and stretch your hands to extent where they start paining. Stretch them very tight till it pains. If you're feeling the pain, release. Now close your eyes really very tight and see that there's some pressure on your facial muscles. I don't know how you do it. You can turn your face in any awkward position, but see that you put a lot of pressure on your face in a way that it pains a little. And after that pressure, you feel that pressure, release. Relax your body. Allow the stress to come out of it. Now think about the most positive thought you could think. That could be your best present, your best friend, your happiest moment with your parent or sibling. And remember, you are a very important person to many people around you. Now I want all of you to inhale and exhale and release the stress out of you. You can take your time and open your eyes. And thank you so much for doing. So this is the way, dear friends, in how we, this is a tested way. I have not built it, but this is a tested way of releasing stress. And, this is for a short-term stress. And when you are really feeling, stressful and you want to release it immediately, you can always try it. Thank you so much. So enjoy your life as it comes, and thank you. Thank you, sir, for providing me this opportunity.
Thank you, Radha ma'am. Thank you for your wonderful session. Thank you for making everyone to relax themselves and to go into other level and release their stress. Thank you for sharing that. What is the difference between the eustress and de-stress? It's very important, and most of the time people don't understand what
Thank you,
is the
sir.
difference between eustress and de-stress. Because sometimes people say that no stress is better than anything else, but better than nothing like that. And you gave clarity that what is the difference between eustress and de-stress and how you can make it better. And also, you have given lot many techniques, tips, and techniques how to work on them. It may be a breathing technique, it may be a visualization technique, it might be spending time relaxing at your place, and how to say no is also very important if you want to reduce your stress. Even if you're not able to say no, what can be done? And it was a wonderful session where I'm sure that all the viewers on YouTube, they have practiced this relaxation, muscle relaxation technique, which made them to feel stress free and make their life more happier. Thank you once again, Radha Kiranmayi ma'am, for making your time to speak on the important topic during this COVID time, and where we are talking about the second strain or second wave. The people are more stressed, and also you shared the reason why the stress is increasing because we are bombarded with all the negative stuff and worrying stuff with all the channels of the print of the electronic media. Thank you for giving all the tips, and I'm sure that now all the viewers will watch this, and they will also like and subscribe the channel, and make their life more beautiful and enjoy your life. And with Use stress, not with de-stress. Still, if
Thank
you
you
are
so much.
de-stressed, please consult a psychologist or a psychiatrist. Choice is yours. And once again, I thank Dr. G. Radha, my ma'am, assistant professor who has dealt with the talk on stress management. Thank you very much for you, ma'am, for your time and for sharing your knowledge. To the people. Thank you very much.
Thank you so much, sir, for giving me the opportunity. Thank you.